Okay. Well, thank you everyone for joining again. This is, of course, is the October 2025 edition of the State-Based Marketplace Project Partner Listening Sessions. My name is Amy Coben. I'll go on video here if my if my camera will work. And I am more than happy to be here. I'm the Marketplace Communications and Public Engagement Analyst. I'm always happy to join you all and to share exciting information from the marketplace, and more importantly about this project specifically, which is near and dear to our hearts. So I'm going to go ahead and share some information, and then I'll introduce our special guests, if that's okay, Claire, because you've got tons of great information. So before we get started, I just want to remind everyone that the purpose of these listening sessions is really to get feedback from our key partners, which we consider to be our insurance carriers, our application assisters, and our insurance agents and brokers. And we're looking for feedback specifically on your experience using healthcare.gov, how we can improve within the new state-based marketplace, and, really just where, today we're really going to want to hear where you would like to be involved in the process. So we are here, we call these listening sessions because we really are here to listen to you. Of course, we have a lot of great information to give to you as well, but our primary purpose is really to get the feedback from you as really key players in the work that we do. So just to lay some ground rules to make sure everybody feels comfortable and confident with sharing their information or their insights. Please remember to stay mentally and physically present with the meeting today. To contribute to the meeting goals that we are outlining here, we want to give everyone a chance to participate in a meaningful way. Make sure to listen with an open mind if you don't mind. Everybody is coming from a different place and a different perspective, so we may have differing opinions, and we just want to keep an open mind when we're listening to everyone else's observations or experiences. We do ask that you stay on point and on time. We have yet to have an issue with time in our listening sessions, but we definitely want to respect everyone's time that's on the call today. So we just ask that you remain on topic. And then last but not least, to identify any potential action items. We are all ears if you have complaints or constructive criticism. If you have a way that we can improve, then that's even better, because we can take those tips or advice and see what we can implement in our new system or processes. So wanted to share that as well. All right, so we're going to get started here with the project update. And let's get going. So as hopefully you all know, we had successfully finished phase 1 of our project, which is the planning phase. There was a lot of work that went into phase 1, and it was a kind of a big hurdle to get over. There's a lot of project management that went into that phase. But the biggest chunk of work that went into phase 1 was our procurement process. And so we did complete phase 1 at the beginning of August of this year, when we executed our contract with our wonderful vendor, which is Get Insured, which is who is joining us today. I'll introduce them here in just a moment. This is just a list of some of the accomplishments that we have made to date within phase 1. So there's a lot. I'm not going to read all of this, but just a couple of things that I want to point out at the end of this list that are a little bit newer is with completing the executed contracts with Get Insured, we did also receive the Stage Gate 3 endorsement, which is another kind of box that we have to check as we go through the process with the state technology project system. So that was another big step and huge hurdle for us to jump over. And then we did also, within phase 1, complete the research and development of our SBM brand name and creative development. Thank you to everyone for your insight on, our SBM brand name and the creative process. I'm not gonna share. I'm gonna keep you guys on pins and needles. I'm not gonna share with you all what we landed on quite yet, but I'm super excited to share that with you all because it really did end up really fabulous. So and then this is a little bit hard to read, but just to kind of give you an overview, this is what we're looking at now. We are now firmly in the implementation phase. Right now, we've been working a lot with Get Insured to really hone in on our detailed budget and schedule to make sure that we're all aligned with what the implementation phase will look like, and also to make sure that we can communicate with all of our different partners, whether it's legislators or leadership or partners like yourselves on where we've been and where we're going. And so we've got a lot of different steps. I'm not going to read through all of these, but there's a ton of different things that we've got coming up in the next few months, leading up until to open enrollment. I'm counting down. I started the official countdown. We're at 12 months. So I started the countdown 12 months until open enrollment for next plan year 2027. So I've started next month when the partner updates goes out. There's a little countdown in there, so I'm going to start putting that in every month. No, but we're not excited or anything on our end. So we've got a lot of steps to take, but we do hope to engage with you all and to make sure that you're part of the process as well. We want to bring you all along and make sure that you're there with us and that you're following along and that you're able to give input throughout the process as well. All right, with that, I am going to actually hand off the presentation to our partners, which is Claire and Jason. They are joining us from our solution vendor, which is Get Insured, and I will just give it to you all to take it away.
Well, thanks so much, Amy, and good afternoon, everybody. My name's Jason Sparks. As Amy mentioned, I work for Get Insured. We've been fortunate enough to be selected to implement the state-based marketplace, full state-based marketplace, both the technology solution and the contact center solution for Oregon's health insurance marketplace. And this community is actually really, I got to say, kind of near and dear to my heart. I I've been around the ACA since day one, sort of when it was when it was legislation and a legislative idea in the eyes of some, and I spent about 4 years as the chief operating officer at a company or a nonprofit, I should say, called Enroll America, that some of you may have heard of, maybe. We did a lot of work around partnering with the sister organizations, navigator organizations across the country, particularly in non-expansion states in the early years, focused entirely on getting the word out, right? Making sure that folks across the country were aware, were informed, that they knew what options were available to them. And just did a ton of work with Navigator and Assister orgs, and can't say enough about how much I personally appreciate the work that that this team does. I know it's hard work, it's long hours, but the the outcomes, as we all know, are priceless. So since then, I moved on to the DC Health Benefit Exchange, where I was the CIO for a number of years, and then almost 5 years ago now, I joined Get Insured, where I'm the vice president of implementation and project management. So I get to work with all of our wonderful state clients that transition from the FFM to becoming a state-based marketplace. With me today, yep, we can just go ahead and advance, please. Thank you, Amy. So we're presenting, so not all the folks on this slide are here, but we just wanted to sort of share some names and faces of our core implementation team. Um, every member of our implementation team has been involved in at least one, and most of us multiple transitions from the FFM to an SBM. Claire's the exception to that. We actually recruited Claire. I'll steal a little bit of your thunder and then let you introduce yourself. We recruited Claire from work that she was doing with our federal regulator with CMS. So hasn't worked directly on SBM transitions on this side of things, but is just doing a fabulous job as our project manager. Claire, did you want to say a few additional words also?
Sure. Yep. It's great to meet you all. I have been in the marketplace space for the last 10 years, and as Jason said, it was mostly in support of CMS and specifically CISIO. I started more on the plan management side, so making sure our carriers met the requirements, and so have worked with Katie Button for 10 years. And it's awesome to be able to work with her again in a very different but still marketplace focused capacity. In my latest role with CISIO, I helped to lead the return to normal activities after the COVID pandemic. So helped the marketplace and states get ready for Medicaid unwinding. And in one of those many hats that I wore during that time, I got to make sure that our sister groups were up and running and that we had additional support. So worked with CISIO to make sure that we brought back the EAPs, that they had the resources needed. After a 10-year hiatus from the start of the marketplace, hadn't had our enrollment assistance personnel and worked to bring them back to really make sure that folks were supported during that time. So certainly appreciate and admire the work that assisters do and the gaps that they fill in supporting our consumers and getting the support they need. So yes, very familiar with the marketplace and learning more about the SBM components. And it's been great to be able to work alongside lots of folks from Oregon to make sure that we're able to support you in the best way possible. So it's great to meet you all.
Awesome. Thanks, Claire. Again, we've got core leadership members on the Get Insured team. We have really dedicated an exceptional team. I would humbly suggest to support Oregon and all of the partners that the exchange is going to work with over the next year. Incredibly, just a year now to get to go live. So some of the faces, some of the names that you see on this slide, you'll encounter as we continue these conversations over the coming months. 300, yeah, yes, a not not a huge number of days, a lot of work to do. So we can go to the next slide, please. So super briefly, just about Get Insured. So, we've been around, the company's actually been around for 20 years. This was our 20-year anniversary, interestingly enough. We got involved in the state-based marketplace world in 2013. And the first state that we brought onto our technology platform was Idaho. So the Your Health Idaho Exchange, which has been now a decade partnering with us, which we've been, really fortunate to, of course, have that relationship. And then over the years, as you'll see on this timeline, our footprint has grown, and there are now going to be 10 states utilizing the Get Insured technology solution. Most of those states also use our Consumer Assistance Center, what we call our CAC, contact center, if you will, solution, which is integrated with our technology solution. We'll talk a little bit more about that this year. And so in, 3 days' time, both the state of Illinois and the state of New Mexico go live for their first open enrollment with our technology and our contact center. So all to say, we've done this a lot. We've got a lot of experience, a team of we get to be the face. Claire and I get to have the privilege of being the face oftentimes of Get Insured, but behind us are hundreds of super talented software developers and quality assurance folks and release managers and everybody across the board that it takes to develop and maintain a system that's this complex and supports this many different partner groups. Great, so we can go to the next slide. So what are we actually providing? So Claire's going to talk a little bit in a second about some of the specifics with respect to the assister portion of the solution that we're bringing forward. The overall concept of the Get Insured solution, what we call our marketplace platform, is again bringing together technology and also people to get to the outcomes that we desire, which are maximizing the number of folks who are able to enroll in coverage, making sure those folks get accurate eligibility determinations, making sure that the data that needs to go to insurance carriers goes to insurance carriers, and making sure that assisters and other partners are able to seamlessly support those folks in their communities who look to you for expert enrollment professional assistance. And so to do that, we've developed this concept, and I'm not going to go through every little box on this slide, but kind of the takeaway that I would suggest here is each different partner group, whether it's consumers or brokers and agents or assisters or our internal staff, our contact center staff, the exchange staff, insurance carriers, have what we refer to as a portal. These portals are all integrated with a single integrated system. What the portal essentially means is it defines what functions individuals can perform within that portal. So again, Claire will talk more about sort of specifics with respect to the assister portal itself. But what I get excited about here is then kind of thinking back to my days at Enroll America, where organizations that we funded, navigator organizations, for example, that we funded, had to submit paper, not only paper grant agreements, but periodic reports on paper, had to track their interactions, their events on paper. We're all familiar with checklists, or not checklists, sign-up sheets and clipboards, I'm sure, right? What we've been able to do, and by getting lots of feedback from the states we partner with, and also from assisters and agents and other partner groups, is build that kind of functionality into the platform itself. So as a navigator organization, the navigator organization has an account, it has a presence within the Oregon health insurance marketplace ecosystem. That presence gets associated with what the assisters who work with you. You've got the ability to create sites and subsites and assign assisters specifically to those sites. The assisters had the ability to customize and configure their public-facing profile that's then presented to consumers who search for local assistance. If you think about kind of the find help concept on healthcare.gov, something similar to that. And perhaps most importantly, have the ability to actually log into that assister account and view information about the clients, the communities that you serve. And by that I mean, all of their application information, being able to submit applications on their behalf, report changes on their behalf. If you're able to, assist with plan selection, be able to go through that process. together with them. That's one of the benefits of having this really tightly integrated system is every user in the system has access to the same database. So we're excited about that. We're excited to. I think we're going to demo that for you in a future discussion. So a little bit of a teaser there for you. But uh, again, integrated solution, integrated system, and the technology's all also integrated with our contact center, which gives us a lot of ability to work together with our state partners to customize and to craft solutions that work best for the individual state. So I think let me just take a look at the slides. I've said a lot of words. Do we have questions? I apologize. I did join a couple of minutes late. Um, but happy to take any initial questions before I pass it over to Claire to really sort of double click on the assister portal portion of the solution.
Awesome. We can certainly take additional questions and discussion at the end.
Absolutely. And in the chat as well, please feel free, to drop those questions in the chat, and we'll try to respond to them real time. And if not, certainly be able to follow up together with our OHIM partners. Awesome. Thanks, Amy. So if we wanted to just move to the next, I'm gonna hand it over to Claire at this point.
Cool.
Thank you.
Thanks, everyone. So yes, as Jason said, we can now start to take a little bit of a closer look to talk through what assisters can anticipate. In the next couple of slides, we'll highlight some of the key features that we're really excited about and want to make sure that you understand you'll have access to. These are features that are robust and are ones that are not currently available on the FFM, and so excited to be able to introduce them to you throughout this year and then really start to launch them at the start of open enrollment next year. I think overall, and Jason's really hit on this, the goal of our work is to make your life and the life of consumers easier. We've worked to create an integrated solution to make it easy for you to access the resources you need to support your consumers. And then at the same time, of course, are keeping the consumer at whole in mind as we work to create a platform, a contact center, and just an overall experience that makes enrollment easy for them. So taking a little bit of a look at the assister solution, our goal is to make sure that our folks have access to the communities that they are serving, as well as allowing our marketplace folks to have access to the activities that our assisters are providing to consumers on an ongoing basis. And then we also can talk a little bit more about some of the specific administrative privileges, as well as some of the other features to help you manage your day-to-day activities. So Amy, I think we can head to the next slide to highlight just a couple of those key components. Awesome. Yep. And so Jason started to tee these up, but just wanted to drill down a little bit more. So these are just a couple of the key features that we wanted to make sure that we called out today. And again, like Jason said, this will be part of a future demo. And so these are just to kind of wet the whistle and for you all to get a sense of what you can anticipate throughout this year. The first component is the contact center support. We're really excited to be able to offer dedicated contact center support for assisters, as well as, of course, consumers. We want to make sure that you have the resources that you need and as close to real time as possible to support consumers throughout their enrollment journey. This also includes a multilingual frontline consumer phone and chat support. And we know in particular that this is important to Oregon, that there's lots of different languages that are spoken and present in Oregon, particularly for the marketplace population. So excited to work with you all to evaluate how best to provide that service to you and to our consumers. The next component is being able to act on behalf of consumers. So like Jason noted, this component offers that full service consumer application and enrollment support. So being able to view your consumers' applications, to see where they are in the enrollment process, and to be able to better pinpoint ways that you can help to unstick them in that process. So our sister portal allows you to have access to better be able to see across the gamut of your consumers where those application sticking points might be. Our next feature is the streamlined profile creation. So we really want to make sure that assisters have the ability to reflect on an ongoing basis, certainly as locations or access information changes, where they are serving, their hours of operations, the various communities that they serve, and then any other changes or notices that they may want to share with consumers in terms of their physical presence, so that consumers can really understand where they can go to receive that support from you all. And this can all be done within the portal itself and then shown to consumers and the public at large to help with that connection component. And then the final piece that I'll note today is the reporting functionality, which I think is really cool. We want to make sure that assisters can see essentially a dashboard of who they're working with in a really easy way. So this will allow you to take a look at the applications and enrollment at the assister level. And this is available not only to assisters, but we also want the OHIM team to be able to view this as well, to understand where consumers are, where they're assigned and being supported by assisters across the population. So these are just a couple of the key features. And again, we'll get into these a little bit in more detail, and you'll be able to see them and how they'll be for Oregon in future demos. Awesome.
And I just have to jump in and say really quick, Claire, that I know from my standpoint, I'm very excited about the built-in reporting functionality, because we have not, for our sisters especially, we have not been able to, up until this point, accurately or even remotely show the impact that our assisters have had on our marketplace enrollees. And so this will give us a chance to really give credit where credit's due to all the hard work that they're doing. So very exciting.
I love that. No, and I love that, Amy. And this is, yeah, I mean, my experience with the assister community has been similar, right? That you can't just quantify. We shouldn't be looking at the success of assisters, in my personal opinion, not speaking on behalf of Get Insured here, but in my personal opinion, simply by looking at the number of enrollments in an open enrollment period, right? There's so much more that y'all do to inform, to educate. Maybe somebody goes through and they're assessed Medicaid eligible. That's still a great outcome, right? That's still getting somebody who's who doesn't have coverage into coverage and into care, in my view, again. And so I totally agree with you, Amy, that having that ability, I think, is really powerful. And then would just add to that, from within the assister portal, and we'll go through this, of course, in the demonstration, that or demonstrations that we do, both at the entity level, what we call the entity level, right? And also at the individual enrollment counselor or assister level, is the availability or the ability to see, what is the population that I'm currently serving? Who are the individuals who have come to me for help? And not only that, but where are they in the process? So, it's November 5th of 2026, and we've renewed everybody. And you want to come in, you want to look at, are there open data matching issues? did these folks get renewed into the right plan for them? Do you want to schedule an appointment with them, right? Having that ability to do that through the system and not have to call a remote contact center to get that information, we feel is pretty powerful. The other thing that I would say, as we work together is we'd love your feedback, right? Most of the enhancements that we have made to the Get Insured solution have come from uh, either our state partners directly, they've come from our internal product management team or other folks in within Get Insured, but probably many of the most impactful ones have come from our carrier partners, our assister partners, our agent partners. We completely redesigned, in fact, the assister portal over the past year based directly on specifically on feedback that we receive from state partners and from assisters and entities. So one of the and this is not me in sales mode, it's just take this as information. We deliver a product that is continually updated and enhanced. So as the Oregon team knows, we deliver between 3 and 4 major feature releases every year. And those releases are all designed to take in, that feedback that we receive, take in those great ideas that we receive from outside of our company to make the product better. And as a result, everybody who uses it and ultimately the individuals who are being enrolled in coverage ideally are benefiting from it too.
Awesome. Thanks, Jason. And thanks, Amy. I guess the last item that we want to talk through is we gave you all of these cool things that we're going to do, but when are we going to do them? So we have 368 days. We've broken it down into a more digestible time frame. So highlighting some of the key phases of the work tailored for assisters, just so that you all have that snapshot. So as you can see, and as Amy alluded to, we are in the midst of configuring the platform and the contact center. We have started conversations with Oregon to make sure that we understand their requirements, that we're configuring the systems in a way that makes sense to them and really meets the needs of your consumers. And as you can see, that will take a good chunk of time. We want to make sure that it's stood up, that we've done the rigorous testing components with Oregon and any additional testing partners, that we've had the conversations with CMS to make sure they accept the product that we're put together and that we're gaining their approval as well. So that's really the phase that we will be in for most of the time as we work to really create that product that meets Oregon's needs and meets overall CMS's goals too for what this looks like for state-based marketplaces. The next big item that we wanted to flash for you all is once we've started to finalize what our systems will look like, this is when we'll start doing trainings. And as Jason said, there will be a couple of different demos along the way where we'll be able to showcase what things are starting to look like before we head really into that more intense training period where you'll get a better understanding of what that portal will look like, the various roles that folks on your teams and within your assister organizations can and will play to support consumers, as well as additional resources that may be helpful just in terms of understanding what consumers will experience so that you're equipped to answer their questions as well as they have them as they go through their enrollment processes. So that'll take us really through the end of next summer and then the beginning of October to make sure that we're ready to go ahead of open enrollment. The next big activity we have listed here is the soft launch. And so really all this means is before open enrollment, there will be certain features of the platform and the contact center that are live to make sure things are working correctly. At this point, consumers won't be able to shop for plans or enroll, and there will be limited access for assisters as well, up into a certain point. But this is really for us to make sure that we can get confirmation that the product is working, that we've been able to stand up the platform and the contact center, and to do our final testing and tweaks as needed before the big day, which will be in 368 days on November 1st, 2026. So this will be the start of the open enrollment period. At this point, shopping is live for our consumers. You will have access to, we are not counting. We're just excited. Where consumers can have access, and where you all too will have access to the full gamut of information that you'll be able to see in terms of the consumers that you're supporting, their various applications, their enrollment information as well. This is also, and I'll just note this is also when local help will become available. So during that soft launch, local help will not be available. Local help will be available once open enrollment period begins. And then the last period that we've articulated is just ongoing operations. We know that this is just the beginning. This is just planning for the first year, for many, many, many more to come in terms of the history of Oregon Marketplace. And so really just provided that note that our continued support will be present after the start of the open enrollment period for 2027, where we'll help the marketplace team certainly help alongside you to make sure that consumers are able to get the coverage that they need from 2027 onward. So that's generally what we have for the next year of busy phases. Along the way, there will certainly be engagement points with assisters to check in and to provide you updates just like we're doing today. But the bulk of where we'll start to interact with you all is really next summer. Awesome.
Gonna take myself off mute. And I was just gonna add here that we are very, as we look at the timeline, right? It looks like a lot, and it is a lot, and there are a lot of activities happening, not just on this work stream, but across a multitude of work streams to get the SBM ready to go live a year from now, with really less than a year from now. What I would leave you with is we have as I mentioned at the top, a tremendous amount of experience doing this. This year alone, we're taking two states into our platform, one off the FFM, one from an existing vendor. Last year, we migrated Georgia and their 1.3 plus million enrollees from the FFM to Georgia Access. The year before that, we migrated Virginia. 2 years before that, Pennsylvania and New Jersey. So, we have a very detailed, robust, and well-practiced playbook for executing and implementing against a 12-month timeline. So, and I'm happy to have conversations with anybody about any concerns, anxieties, worries with respect to the timeline. And I'm sure Amy is as well. But I can just say with total confidence that we've got the right team, we've got the right processes, we've got the right people, and we've got an exceptional partner at OHIM who's been operating a state-based marketplace on the federal platform for all these years. So you're not starting fresh with a new set of staff who don't have ACA experience or don't have SBM experience. So we're really excited about that and think we're feel confident that we're well positioned to deliver on this timeline.
And just a reminder to our partners, that's one of the reasons why when we put out our request for proposals, we were looking for a vendor that specifically had an off-the-shelf solution that we could customize to Oregon's needs. And, we wanted to get this going as quickly as possible, but also being mindful of making sure that the experience was there and the reliability and all of the things. So, yes, we're very excited on our end as well. I think what we'll do now is we'll move forward to questions. And I did put together just a couple of discussion questions just to maybe prompt some thoughts or comments. We don't have to stick to these discussion questions, of course, but would love to hear from you all, our sister community, what types of communication or engagement would be most helpful as we're moving through each phase of the implementation process. As you know, we're currently sending newsletters, we're doing listening sessions, we send our monthly updates, etc. So what's working, what could we be doing better, or what could work, what could we add? How much lead time do you need to prepare your teams for any system changes or new functionality? And then is there any specific time of year or operational cycles that we should avoid when planning testing or training activities? So those are just some discussion questions that we put together. As a reminder, you are not able to come off mute naturally, but if you put your hand up, I can allow you to come off of mute. So that's how we do things here. Does anybody want to break the ice and jump in with any questions or comments? And Claire and Jason, I always feel like I need Jeopardy music at this point of the conversation as folks gather their thoughts. It always gets really silent.
That's right. Everybody's deciding who wants to go first, right? And Amy, we can also, I think we've got a process or a thought to being able to take questions, of course, offline too, if folks didn't want to share them here, right? Yeah.
Yeah, absolutely. All right. Well, seeing as we don't have any hands up so far, we can go ahead and I'll move on in the presentation, and of course, give you all some more information on how you can stay up to date, and also, as Jason said, send us some more questions or thoughts if they come to mind after we get off the meeting today. We do have our project email still up and running, so feel free to send an email to us at marketplace.sbmproject@oha.oregon.gov. Those come straight into our project team, and we're happy to respond as quickly as possible. We also have a really short form that you can fill out on the link that you see on the screen here. You can submit questions, comments, or any kind of feedback. And those come straight to me, and then I'll work with our project team to get you a response. And then we also post those, if applicable, on our FAQs website as well, so that they'll benefit everyone. And then just another couple of quick plugs. We do have as I mentioned, we do have our quarterly email updates that we're sending out. We do typically send them out 4 times a year. And we have one that we're gearing up to send out here probably in the next week or two. And then we have our project website. So if you've missed our past listening sessions and you want to see what we talked about, or you want to check out our quality reports or anything else, you can check out the project website. We also, like I said, have a FAQs database on the website. So you can, if you've got questions, they might already be answered. Rebecca, thank you so much for the feedback. I'm going to take note of those comments so that we have them for the future. Thank you. All right. And with that, that's actually the end of our presentation today. So just want to thank you all again for joining and sharing a bit of your day here with us. And I just hope that you all have a great rest of your afternoon. And happy almost open enrollment.
Yes, yes, yes,
Caroline, let me. Oh, nope. Oh, okay. I got excited.
yes.
All right. Have a great day, everyone.
Thanks,
Thank
y'all.
you.
Take care.